Vital signs are a person's temperature, pulse, respiratory rate, and blood pressure. As you'll see as you watch the skills demonstrated in this module, these measurements are indicators of body function and reflect the status of a person's health. So a change in vital signs may indicate a change in health. Assessing vital signs is an integral part of nursing, and doing it right is important to make sure you have the accurate data for the patient's plan of care. Let's start with temperature. The most common way to take a temperature is orally, but you should avoid the oral site if the patient has had mouth surgery or a disease of the oral cavity. You'll often take the patient's pulse next. The most common pulse site for children and adults is here, the radial pulse at the wrist. Pulse rates are measured in BPMs, beats per minute. While counting the pulse rate, note the rhythm and quality of the pulse as well. Respiratory rate is determined by counting the patient's breaths per minute. It's always best to do this right after taking the patient's pulse. That way you can transition into counting breaths so that the patient is unaware and won't change their breathing pattern. While checking the respiratory rate, note the rhythm and the depth of the patient's breathing as well. Finally, you'll take the patient's blood pressure. BP is measured in millimeters of mercury and is recorded as a fraction. Systolic pressure over diastolic pressure. It is typically measured at the brachial artery site using a stethoscope and a sphygmomanometer. As the nurse, it's your responsibility to ensure accurate vital sign measurements and to report any abnormal findings. Assessing vital signs the right way, every time, is crucial for good nursing care in any setting.
Okay, and what's next?
I'm going to be getting the vital signs on my patient as part of my assessment.
Do you have everything you need?
Yes, I think so. Digital thermometer, blood pressure cuff.
Is it the right size for your patient?
Yes, and of course, a stethoscope.
Okay, just a couple of things before we see your patient. Remember, when you're taking an oral temperature, you need to assess whether or not your patient can follow directions.
If not, they could get hurt, right? Like if the patient bites down on the thermometer. So if they can't, then I take their temp another way.
Right. An oral measurement is also contraindicated in patients with diseases of the oral cavity.
And for those who've had surgery of the nose or mouth.
Right. What's next?
Pulse assessment, then respiratory rate. And I shouldn't let the patient know I'm counting respirations because it might change the way they're breathing.
Very good. Any questions on blood pressure?
Not really. Make sure the patient is rested for at least 5 minutes before and hasn't had any caffeine or nicotine in the last half hour. It sometimes takes me a bit to find the brachial artery, but I get it.
And what do you assess for?
I don't want to use the arm with an intravenous infusion or a cast.
Or the side where there's been breast or axilla surgery. You should also not use the extremity with an arteriovenous shunt or an injured or diseased limb.
Oh, now I remember that. We talked about it in class.
Very good, Rose. Sounds like you have every reason to be confident taking these vital signs. Ready?
Let's do it.
Okay.
Hi, Mrs. Hodge. I'm Rose. I'm a student nurse, and I'm going to take care of you today. This is Miss Varga. She's my nursing instructor. How are you doing today?
Fine.
I'm here to measure your vital signs, if that's okay with you.
Yes, of course.
Can I have a look at your wristband?
Sure.
Thank you. And your full name?
Irene Hodge.
And your birthday?
December 6th, 1934.
Great, thanks. Can you hold a thermometer under your tongue?
I would hope so.
Anything to eat or drink in the last half hour?
No.
Gum? Smoking?
Heavens, no.
Very good, Rose. You remembered to ask about these things that can directly impact the vital signs. Remember, if Mrs. Hodge would have answered yes to any of these questions, you'd wait 30 minutes before taking her temperature.
Looks like the thermometer's ready to go.
Remember the cover. Make sure you hear it click into place.
Thanks. There. Open up, please, and I'll just place this right under your tongue. And if you could close your lips around the probe, great.
And remember to keep holding the thermometer. So why is it important to have the probe rest in the posterior sublingual pocket?
Because it's in contact with blood vessels that are close to the surface, and we get a more accurate reading of Mrs. Hodge's temperature.
Very good.
And there we are. I'll take that out.
How is it?
Great, 98.7.
Wow. Glad it's not high.
Don't worry, if it was abnormal, Rose would know what to do.
Report it to the primary care provider immediately.
Now Rose is going to take your pulse.
Is this where you touch my neck like on TV?
No, I'll be taking your radial pulse, and that's on your wrist. I'll count for 30 seconds and multiply by 2, right?
Very good. And remember, when taking a pulse, your fingers should be flat against the patient's skin. And if the pulse is unusual in any way, palpate and count the pulse for 1 minute.
Great, thank you. Pulse rate, amplitude, rhythm, everything's great. I also checked her respiratory rate by counting the number of respirations for 30 seconds and multiplying that number by 2 to calculate her respiratory rate per minute.
Wow, you are tricky.
Well, it's not to be tricky. We try to avoid letting patients know that we're counting respirations because they might unconsciously change the way they're breathing.
Impressive.
Rose, did you assess the patient for respiratory distress, retractions, nasal flaring, grunting?
Yes, regular rhythm and depth. And if the respirations are unusual in any way, then I would count the respirations for at least a full minute.
All right, excellent.
Okay, now we'll take your blood pressure. Okay, I just want you to get comfortable and put your arm like so. Good. How's that feel?
Fine.
Okay, I'm putting her arm on the pillow to make sure her forearm is supported at the level of her heart. Your back's supported. Good. Are your legs crossed?
At the ankles they are. I always do that, but I can uncross them.
Thank you. Now I'm going to slide up your sleeve so I can wrap this cuff around your arm.
You'll want to palpate the location of the brachial artery.
Right. Okay. I'll put the center of the cuff about midway on the arm, so the lower edge is about 1 to 2 inches above the inner aspect of the elbow. And I'll line up the artery marking on the cuff with the brachial artery.
Right.
Okay, and let's see. The needle is within the 0 mark. Good. Now, I'm going to estimate your systolic pressure, which will help make sure I get an accurate reading.
That's good. Estimating the systolic pressure prevents inaccurate readings if there's a pause in the auscultated sounds.
Okay, now I'm going to inflate the cuff. It's going to feel a little tight.
That's okay. I had 3 children. I can certainly handle this.
Note the point on the gauge where the pulse disappears.
Got it. The pulse disappeared at 110, so I add 30 to it, which means I'll inflate the cuff to 140 when I take her blood pressure after waiting a minute or so, right?
Right. Now remember, you'll place the stethoscope firmly, but with as little pressure as you can.
And don't touch the clothes or the cuff.
Right. And note the point on the gauge when you hear the first faint, clear sound that slowly increases in intensity and the point in which the sound completely disappears.
That'll be the systolic and diastolic pressures, right?
Right.
Okay. Okay. All done, Mrs. Hodge. Your blood pressure is 112/64. Great.
Now, if you're suspicious of a reading, wait at least 1 minute before you try it again. Remember, if you want to recheck the pressure reading, do not reinflate the cuff once the air is being released. Wait 1 minute and repeat the measurement.
That was easy.
Can we do anything for you before we leave?
No, I think I'm all right.
Okay. We'll be back shortly to check on you. I'll take that. Thank you.
Thank you.
Here we are. And then you got the... Okay. Thank you.
Now, before we finish up for the day, are there any questions or anything you'd like to review related to vital signs?
I had a question.
Okay, what's that, Melissa?
Well, when I was taking my patient's blood pressure, I had a really tough time hearing anything. I don't know.
Okay, see, that happens sometimes. Now, if you find this is a problem, you could try, try making sure the room is quiet. And check your equipment and connections. Check your stethoscope for the correct positioning of the head if it's a dual head, so the sound is being conducted through the bell or diaphragm. Well, depending on the site you're using, of course. Let's see. Yeah, recheck the location of the brachial artery and make sure you have the head of the stethoscope directly over the pulse site. Now apply a little firmer pressure to the stethoscope just to be sure that there's a good seal between the stethoscope and the skin. And let's see, now if you're still having trouble, you might want to try another limb if that's possible. You should practice blood pressure measurement often in a quiet room to become more comfortable with it.
I'll keep practicing.
Good. Now, sometimes there are other situations you'll have to make special accommodations for. You see, earlier Mark worked with a patient who had a right modified radical mastectomy and had a PICC line in her antecubital fossa. Mark, tell me something. How can you go about measuring her blood pressure?
Well, you can't take her BP on her right arm because of the mastectomy.
That's right, because see, there's an increased risk of lymphedema.
And you shouldn't use her left arm because the PICC line is inserted there. Pressure from the cuff could damage the catheter or injure the surrounding tissue.
And so what would be the best site?
I guess the best blood pressure site would be her thigh.
Good. And Melissa, what's the procedure for taking a blood pressure on the thigh?
Place the stethoscope behind the patient's knee using the popliteal pulse.
Right, and just keep in mind that systolic readings in lower extremities are about 10 to 40 millimeters higher than the brachial sites, but diastolic pressure is about the same at either. How about the situation? While you're trying to measure the respiratory rate for a patient and you're not able to see their chest rise and fall, put the stethoscope on the apical site and watch the chest rise and fall at the sternal notch, or you can just focus on the rise and fall of your hand on the stethoscope.
All right, Rose, what's going on with your patient?
Well, my patient has been having problems with his blood pressure. He has a history of hypertension and his blood pressure readings have been pretty high. He's received a new medication to try to treat it. We need to set up the electronic blood pressure device to measure his blood pressure frequently for the next hour or so.
And you have the unit?
Yep, right here.
What can you tell me about measuring blood pressure this way?
This unit determines blood pressure by analyzing the sounds of blood flow, and it does it automatically.
And is there anything to watch out for?
A few things. Irregular heart rates, excessive patient movement, and environmental noise could interfere with the readings.
Good. You know what to watch out for. Any questions, concerns?
No, I'm ready.
Okay then, lead the way.
Mr. Marlin? Hi, remember me? I'm Rose, and this is Miss Varga, my nursing instructor. I'm going to be taking your blood pressure, okay?
Sure. You think it's any different than when you took it earlier?
Well, you received that new medication for your blood pressure, right?
Yeah. It's been kind of high lately.
So we'd like to monitor how well the new medicine is working. That means several blood pressure readings pretty close together. I'm going to set this machine up to record your blood pressure automatically for the next hour or so.
What will they think of next?
Is that okay?
Sure.
Can I double check your ID band, please? Mm-hmm. And your full name is?
Mark L. Marlin.
Great. And your birthday?
5/12/1938.
Thanks, Mr. Marlin. Have you been taking it easy for the last 5 minutes or so?
More like 5 hours. Just me, the bed, and ESPN.
Oh, well, for what we're doing, that's good. I'm going to be putting this blood pressure cuff on you. It will inflate each time to measure your blood pressure, but in between, it'll be deflated without any pressure on your arm.
Doesn't look too different from the other one.
Except this one's electronic. We put the cuff on the same way as the auscultatory method, you know, the other kind. Except this one has a little microphone or pressure sensor that'll position directly over the artery.
High tech, huh?
Any injuries lately on this arm? Medical procedures on this side, anything?
Nope.
Okay, let's use this arm. Now try to get comfortable.
You don't have to bring in my recliner.
Well, do the best you can. Arm like this, okay? I'm gonna roll up your sleeve and I'll put on the cuff.
Okay. Now, Rose, can you describe what you're doing?
Well, first I'll palpate for the brachial artery. Okay. And I'll center the bladder of the cuff over the artery, lining up the mark on the cuff with the artery in the limb. Okay. There we go.
Okay, just remember when using an automatic blood pressure device for serial readings, check the cuff limb frequently.
That's to make sure the cuff deflates between readings, right?
Yes, incomplete deflation of the cuff between measurements can lead to inadequate arterial perfusion and venous drainage, compromising circulation into the limb.
Well, I hate when that happens.
I always double check.
And does the machine have different settings for infants, children, and adults?
Okay, yep, I've got it on adult settings every 15 minutes.
And of course, you'll want to instruct the patient to hold his limb still.
Hand down, Mr. Marlin.
I'm sorry. Guess I got itchy.
That's okay. Now I'm going to turn it on. It'll feel a little tight. Okay, there we go. And the blood pressure reading should appear. There it is.
How's it look?
Okay, 146/86.
That's improved, right?
Yes.
It has completely deflated, correct?
Yep, it's completely flat in his arm.
Let's document. You identified the arm used?
I did, and if we used a site other than the brachial artery, I would have noted that too. Okay, that's it for this measurement. I'll be back to record the remaining measurements and check up on you. Do you have your call bell?
Yep, it's right here.
Can I get you anything else before we leave?
Some ice water would hit the spot.
No problem. I'll be right back.
Thank you, Mr. Marlin.
No problem. Nice to meet you.
All right, I want to show the two of you a little something out of the ordinary. How to assess systolic blood pressure by using a Doppler ultrasound. It's not something that you would have to do very often, so I've asked a patient to allow us to practice with it.
Good. I could use some practice.
Yeah, I'm not that familiar with it either.
Well, since an ultrasound amplifies sound, you can use it to measure blood pressure, and it can be especially useful if the sounds are indistinct or inaudible with a regular stethoscope. This can be the result of muscular atrophy, low pressures, or vascular insufficiency, for example.
So it's sort of like a super stethoscope.
But how accurate is it?
This method only provides an estimate of systolic blood pressure, but still, it's good for those specific situations.
I'm ready.
Yeah, let's get started.
All right. Hi, Mr. Betts. Remember me? I'm Maria Varga, the nursing instructor. Thanks again for helping us out. These are my students, Rose and Steve, and they're going to be practicing taking your blood pressure. Is that okay?
Sure. This earns me bonus points, right?
Oh, yes. Can I double check your ID band?
Here you go.
Okay, your full name?
Robert William Betts.
Right. And your birth date?
February 2nd, 1978. Groundhog Day. Do I get bonus points for that too?
Yes, and they are racking up. So what we're going to be doing is taking your blood pressure and using an ultrasound.
The same thing they used when my wife was pregnant.
Exactly. We'll get you in position, put some gel on your arm, and listen to the blood flowing through your arm. Any questions?
Yeah. Will that thing be able to tell if my arm's a boy or a girl?
Well, now that just lost you some points. Steve, why don't you assess the appropriate limb?
Mr. Betts, have you had any injuries to this arm recently?
No.
Okay, any surgeries or medical procedures?
No, my arms are pretty much a matching pair.
That's good. Okay, well, why don't we get you comfortable? And place your arm like so. I'm going to roll your sleeve up.
And now, Steve, would you place the cuff on Mr. Betts?
Sure.
And where does the artery marker on the cuff go?
Right in line with the artery in Mr. Betts' arm. And I'm going to wrap the cuff so that it's nice and snug. How's that feel, Mr. Betts?
Nice and snug.
Good. So I'm going to raise your sleeve just a little bit more. And there we go.
All right. Make sure the needle on the gauge is within the 0 mark.
Got it.
Okay. And Steve, would you put some conducting gel over the artery?
And this might be a little cold.
That's okay. Just more bonus points for me.
And try using the Doppler first. Use it in your non-dominant hand.
Okay, that'd be my right.
All right. And place the Doppler tip in the gel. Move the Doppler tip around until you hear the pulse.
Oh, sorry.
You can adjust that volume.
I get extra points for that.
Rose, why don't you try it?
Okay, sure.
Move the Doppler around until you hear the pulse.
Okay, there it is.
Okay. Now I want you to inflate the cuff while you're continuing to use the Doppler on the artery. You want to note the point on the gauge where the pulse disappears. And Rose, as usual, open the valve on the manometer and allow the air to escape quickly.
What if you're not sure that we're getting an accurate reading?
Well, wait at least 1 minute between the readings to allow normal circulation to return to the limb, and deflate the cuff completely between attempts to check the blood pressure.
Okay.
Okay, now remove the Doppler tip and turn the Doppler off.
Okay.
Wipe off the excess gel on the patient's skin with a tissue.
Okay.
And then remove the cuff. And then you can clean the Doppler.
There you go.
Well, that was quick and easy. How do I look?
Your systolic pressure is 120, which is fine. We only get one of the measurements with this method.
I see.
Thanks.
As Rose said, this method only provides a systolic pressure reading, but it would at least give us some information about the patient's situation. If it were actually measuring the patient's pressure this way, we would need to identify the arm used and the site of the assessment if it was done other than on the brachial.
And I'd let the appropriate person know if there were any abnormal findings.
Good. Well done. So that's it, Mr. Betts.
No problem. You'll get my bonus point, Bill.
I'll take this one.
Can we do anything else for you before we leave, Mr. Betts?
No, I'm fine. Thank you, though.
Thank you.
Thank you again. So what are we doing for your patient, Rose?
My patient was admitted last night after falling at home. She'd been having a problem with dizziness and lightheadedness. I need to assess her for orthostatic hypotension.
Which is?
Orthostatic or postural hypotension is a low blood pressure condition. It's defined as a drop of at least, is it 20 millimeters mercury systolic or 10 millimeters mercury diastolic in blood pressure within 3 minutes of quiet standing up after having been lying down.
Right. And while you're measuring the patient's blood pressure, what do you assess for?
Throughout the procedure, I look for signs and symptoms of hypotension, such as dizziness and lightheadedness.
And don't forget pallor and diaphoresis. If the patient would be attached to a cardiac monitor, you would assess for arrhythmias. What do you do if symptoms appear during the procedure?
Immediately have her lie down. Return the patient to a supine position.
Right. And do not have the patient stand if symptoms of hypotension occur when the patient is sitting.
Because they could faint and fall and get hurt.
Yes. You have the cuff and the stethoscope.
Right here.
All right. Is the cuff the correct size?
Yes, I already assessed the fit. This one's correct.
Any questions about taking BP or measuring pulse rate?
No, I feel confident about that.
Okay, sounds like you're ready.
Mrs. Paolini? Hi, remember me? I'm Rose. This is Miss Varga, my nursing instructor.
Nice to meet you.
I'm going to take your blood pressure, okay?
As long as I don't have to do much.
Well, we want to see if changes in your blood pressure are part of the problem with your dizziness. So, we're going to take measurements in a couple different positions, but it won't be too much activity, okay?
Well, I guess so. I do want to find out what the problem is.
Can I double check your ID band, please? Okay. And your full name is?
Mrs. Rose Marie Paolini.
And your birthday?
You know how to hit a girl when she's down. May 30th, 1931.
Thank you, Mrs. Paolini. Now, as I said, we need to check your blood pressure in several positions. So, I'm just going to lower the head of your bed.
Will I have to lay here like this for long?
3 or 4 minutes. Are you okay?
Yes, I'm okay.
Have you had any caffeine in the last 30 minutes?
No.
And you haven't been physically active in the last 5 minutes or so?
Well, my head spins from time to time. Does that count?
No, but let me know if that happens while we're taking the measurements. Okay, so you have to lie here for a few minutes, then we'll measure. I'll put the cuff on the other arm since I see this IV is on your left. Can I get the pillow, please? Thank you. Okay. Now we need to take your blood pressure and pulse. Okay. You can take that, please. Thank you. Okay, now we're going to sit up and take your blood pressure and pulse again.
As long as you promise to catch me.
Okay, would you like your head up a little?
Oh, please.
Sure. Good. Oh, easy does it. Let's put this rail down. Great. All right, how do you feel?
Not too bad.
Okay, try to get comfortable now. Okay, put your arm over like this, and I'll put your arm on a pillow to make sure your forearm is supported. That way it's at level with her heart. How's that feel?
Fine, I guess.
Okay, how do you still, any dizziness, lightheadedness?
No, I'm okay so far.
Okay, so we wait a few minutes.
Do you still feel okay?
So far, so good.
All right, now I'm going to check your blood pressure and your pulse again.
At this rate, I'm going to be a real pro at this stuff.
You sure are. Okay, thank you. Now we're going to try it again, standing up this time.
We'll see.
Do you feel up to standing?
I guess so.
Well, if you're not sure...
No, I'll try it.
Okay. Okay. How do you feel?
Not too bad. You can do what you have to do.
All right, well, we need to wait another 2 or 3 minutes. Are you feeling okay? Are you feeling dizzy or lightheaded?
No, I'm okay.
Okay. Are you still okay? Are you all right?
Yes, I'm okay.
All right, double check the cuff, Rose.
Okay. Okay, looks good. It's going to get a little tight, and I'm going to take your blood pressure and pulse again. Great. Are you okay? Let's get you back into bed. Good. All right, let's get this cuff off.
Okay. And I'll take the pillows and we'll put them back where they were. There we are.
Good.
All right.
Great.
There we are. So you've got the blood pressure measurements and pulse rates from 3 different positions. We're going to record the measurements for each position, noting the position with the readings. And if you have an increase of 40 beats in the pulse rate or a decrease in the blood pressure of 30 millimeters of mercury, what's that tell you?
Well, that would be a cause for concern, but fortunately, not the case for Mrs. Paolini. There was very little change in the measurements from lying, sitting, and standing.
Well, that's good, right?
Yes, that's a good thing. Now, if you're suspicious of a reading, wait at least a minute before you try it again. Remember, if you want to recheck the pressure reading, do not reinflate the cuff once the air is being released. Wait 1 minute and repeat the measurement.
Okay, all done, Mrs. Paolini.
That wasn't so bad, I guess.
I'm just going to make a few more notes here in your record.
So what happens now?
Well, I'll show these results to your primary care provider, and he'll talk to you